Hi guys, welcome back to my Coaching Coins channel. Today I have a special guest. She is a colleague of mine. We graduated from the University of Texas together in 2013. Today I want to do a special sessions on community pharmacy, and she's currently a pharmacist that's been there and working there for a few years, so I thought it'd be great to have her to share some insight. So with that, I'm going to pass the buck on to Sophia so she can introduce herself and get more information.
Hi, my name is Sophia. I've been a pharmacist for about 5.5 years now, a pharmacy manager for almost 4 years of that time. And yeah,
Awesome.
Ready to get started.
Thanks, Sophia. So I thought it'd be fun just to kind of having her share some of her insights and tips, especially about community pharmacy, for those that are interested in that arena. This could be for students, but also for practitioners who are interested in to get into the community setting and what that journey would be like. So, Sophia, before we start, can you kind of tell me your journey, how you get to where you are, and just the job that you're currently working?
Okay, yes. So, graduated in 2013 from UT Austin, and as soon as I graduated, I applied everywhere that I could in the retail community, in the retail pharmacies, and I got a few offers, and I decided to go with a store that has a grocery side to it as well, because from my experience as a student, I liked the setting where they had a grocery store. It just seems like a little more friendly. You get to interact with the customers more than in like the just independent pharmacy by itself. And then my journey has been, I worked at a really busy store when I first started, so I kind of just jumped into it. And for me, there wasn't really like much of a training transition period. You just kind of jump in, and you do some trainings online, and then you just start on day one, and you have like someone watching over you and training you as well. But it really is hands-on. That's where you learn the fastest. And yeah, it was interesting. I've been a technician before, which I highly recommend. Definitely try to get either to shadow a pharmacist or be a technician before you decide to apply for pharmacy school, so that you get that experience and know what it's like. From an observer's point of view, it looks pretty calm and sometimes quiet, sometimes not, but there's a lot more going on behind the scenes that you don't realize. So my experience was pretty good. I started at a busy store, I had a good team, and some of my challenges in the beginning was learning to manage my technicians. Just looking as young as I am, all of a sudden jumping into this new retail setting, not really familiar with how things work in this particular setting, and then having to tell my technicians and direct my technicians to help with workflow. That was a challenge when I first started, because there was some resistance there, and also me being new, I wasn't confident myself.
And I really like that you mentioned about for those who are interested in pharmacy school or getting into community setting, having a technician job. Sometimes It's really hard to get a technician job, hospital or in community. One way that I did back in the day is that I applied to a grocery store to be a cashier, and then you just express interest, like, hey, I would like to work in the pharmacy one day if there's opportunity. And of course, there was an opportunity, and they would just take you under their wings and shows you, even if you're a cashier, and then eventually you can kind of move up to be a technician. That might be one way, instead of always like just waiting to get into a pharmacy technician straight. Especially when you're a student, they tend to, you don't have the stability and the flexibility that most of the employers would like. So being a cashier would be a good start out. To get that experience. You mentioned in terms of training, like what kind of, I know different stores have different kind of training, but do you feel like pharmacy school prepare you well to do what you needed as a pharmacist at a community facility or community setting? And then what are some things that you've learned from school-wise and things that you've learned from kind of on-the-job training?
So for the knowledge side, I definitely think they prepared us pretty well to know the drug interactions and the clinical side. But for the retail side, besides the rotations, I didn't learn quite as much to prepare me for actually being in the pharmacy setting. A lot of the pharmacy setting in retail is communication and working with people. Just keep in mind you're dealing with patients who are either sick or in pain, or they are filling prescriptions for someone they love that are in that condition, either suffering from pain or have some kind of mental illness or stuff like that. So they're not always in the best mood. And a lot of the perception in the retail pharmacy from the patient's perspective is that we're just pill dispensers and that's all they know and see. So they kind of expect it to be quick. Just, pour pills into a bottle and it shouldn't take that long. So there is that you have to deal with. And then the managing your team aspect, that I didn't learn in the school setting. So that I kind of had to learn on my own. I actually went to Barnes and Noble and the library and just kind of checked out management books just to kind of learn myself how to manage a team and manage other people. What else?
And then what do you learn from what are some routine your day-to-day function look like as a community pharmacist?
As a community pharmacist, so as a community pharmacist, we have to manage our time really pretty wisely. So I'll come in, depending on the previous day, 15 to 30 minutes early if necessary, just to get started with tasks that I think I might not get to do during our workflow. Because once we open that gate, it's nonstop, just kind of answering phones, getting the drive-through, filling prescriptions, solving problems, stuff like that.
And then previously, for those that are interested in community and may want to kind of test out, every community rotation is different because not all stores are the same or all students get sent to the same rotation site. So what's considered a busy store and what would consider a good learning environment in terms of community pharmacy when someone has been set into that environment?
If you're starting out, it might be best to try to request a slower store. You mean as a student, right?
Yeah,
or
as a student.
New pharmacist.
Or even a new pharmacist too. Yeah, from both ends.
New pharmacist, it's definitely, well, I guess there's pros and cons to each. In a busier store, there's designated people who work at designated stations. So there's actually less running around to different locations. So there'll be one person typing, one person dispensing, two pharmacists, one person verifying. So stuff like that. But at a slower store, you'll do more, and you'll have more time to do those different things. So it varies. It's a good experience to do both, actually.
Yeah. And what's in terms of quantifying the prescriptions, like what makes it a slow store versus a faster store? Like
usually busier stores will do over 300 scripts per day, and the slower stores would do 200 or less.
Okay, so that's good to know. And I think as a student, I don't think you can always choose your site, but that would be something you can always ask your preceptors. Take the opportunity that you have. If you're in a slower store, just do more than help fill in prescriptions, but be involved with like health fair. Some grocery stores out there that do like second Saturday health fair, be in like flu vaccination if you're in the flu season. Try to learn more about how to administer immunization shots, things like that. So you can kind of branch out. Some community pharmacy has a very active program, medication management therapy, MTM. So that could be also something that you can build for them or grow the program. If it's a slower store and it's an opportunity for you to learn, even on a busier store, try to help with like patient counseling. As Sophia mentioned, that a lot of our patients do come to the pharmacy, and we're basically the last gate after they see their doctor and get all this and driving. So they're tired at this point and sometimes may be frustrated, but being patient with them and really explain like the medications, because it's a lot of details that being covered either during their visit or during the urgent care, wherever they have been. So you're basically their last gate before that medication goes in their body. So it's very important to really educate them on things and just get to know them.
Mm-hmm. Right? Yes, building that relationship with patients is very important. Yeah.
Yeah, and I think Sophie also pointed out a very good thing is management. I don't think most schools teach students on how to manage people, but when you're a pharmacist by nature, you are a supervisor. Regardless of what setting you work in, you either have someone you work with as peer, or you have someone work with you, like other pharmacy technicians, that you need to either do their schedule, counsel them if they show up late, just all these things that you may not expect when you're a pharmacist in addition to your clinical work. So being able to learn that skills, and I like that you went to Barnes & Noble. I actually also have like several books to read, but the main thing is practice, right? I think that's really important. So you kind of touch a little bit on like some of the challenges that you face. So in addition to people management, what are the challenges that you felt that you could have learned earlier, or you've done something to help kind of resolve it?
Other challenges would be, so community pharmacy is continuously changing. We're becoming increasingly more clinical. So MTMs and other clinical type programs are being implemented, and there's new clinical initiatives probably yearly. So we need to learn to adapt quickly and learn these new programs quickly, and then just integrate it into workflow, just like anything else. It's just a matter of learning things quickly and then finding a way to effectively integrate it into your workflow, because you get used to a certain way and then there's new changes because we are trying to keep up with the demands and with our competition clinically and with the patient's needs. So that's another challenge.
So how do you keep up with those challenges? And I know it's probably work in progress, but what are some things that
but delegating is important. Making sure that everyone has a clear idea of what they're in charge of, because not everyone is there all day. So being able to delegate and then communicate effectively what needs to be done next. Writing notes, communicating with this patient what needs to be done next, and just passing the baton to the next person so that can continue even when you're not there.
Okay. And then can you describe what's the difference between like a pharmacist versus a pharmacy manager in a community settings? What are the similarities and differences?
So the pharmacists have all the regular pharmacist roles of verifying prescriptions and counseling and all of that. And the manager is in charge of operations overall. So now with our company, they're starting to separate it so that the regular pharmacists have more of a management role, so that there's some shared responsibility. But overall, the pharmacy manager is responsible for training, for the numbers, for the growth in scripts, for customer service, for any problems and issues, for keeping up with the state laws and regulations, making sure invoices and inventory is up to date and accurate, record keeping, pretty much everything.
That sounds, yes, and I'm pretty sure there's other duties as assigned at the very bottom too for that.
Yeah. Yes.
So what helped you prepare you to become a pharmacy manager, and what decision point to again lead you to taking on that extra responsibility?
That's a good question. So I knew I wanted to be a pharmacy manager early on. I just didn't know if I would ever be ready. So I did have mentors from school that I reached out to and asked the same question, like, how do I know if I'm ready to be a pharmacy manager? Or um, how do I prepare myself to be a good pharmacy manager? So I would recommend being a pharmacist for at least a year, just so you have a good idea of the ins and outs of what you need to know. I decided to become pharmacy manager actually sort of by accident, but I was also ready for the challenge. My old pharmacy manager left, and I wanted to step up. I didn't think I was ready, but I just wanted that challenge. I knew that I could learn it quickly, because that's kind of how you just jump into pharmacy and you just do it and you learn as you go. So I knew I was ready for the challenge. So I applied and got the role as pharmacy manager. And really, honestly, I just learned as I went.
Which is really a lot of the job out there, right? Like I think pharmacy school really prepares you to do the basic entry jobs, but
Mhm.
overall, it's going to be a lot of hands-on training. Every institution is a bit different. Every setting is a bit different, so they have their way of doing things, and you have like what you mentioned, identifying mentors within the organizations and outside of the organizations to help foster training, as well as kind of someone to as a sound like serving someone in terms of advice. Like you can ask them and they can bounce up ideas with them, and they're like, am I doing this right? Am I thinking about this way correctly? Just so when you're by yourself, it's like you're the lone wolf and trying to get a pack together to validate some of your ideas. What are some tips you have for students or pharmacists that are interested in the community setting, that want to get into the community aspect?
Okay, so for students, pharmacy students, or people who are considering pursuing a career in pharmacy, my tip is to definitely try to set foot into a pharmacy and either shadow or work as a pharmacy technician, so that you can see what it's really like on the inside the pharmacy, and get that experience working in a fast-paced environment and working with people and customers on a more regular basis. Even if it's just a few days out of a month, that will give you some of the exposure, so you can get an idea and a feel for if this is right for you.
And then for those that work in other industry and now want to transition over to community setting, what are some ways you would suggest to help them get acclimated / network?
Okay, so if you're in another industry in pharmacy, then I would definitely consider, if you're going to do retail, if you like dealing with people, interacting with people, customer service, if you're a good communicator and you're good at multitasking, then retail might be a great fit for you. So now that it's harder to find jobs in community pharmacy, I highly recommend finding someone in the company that you want to work for, and asking them for maybe contact for the hiring manager or the supervisor, and just sending an email directly with your resume, as well as applying online.
Are there any organizations that folks can be involved with just to help increase their, again, building relationships and networking with other pharmacists or other pharmacy managers in the community setting?
Definitely. There's local organizations. I know there's a North Houston Pharmacists Association, and there's other organizations, like national organizations, where you can build that network and make connections. And really, you can start building your network and making connections when you start in pharmacy school. Like, don't burn any bridges. Make sure you send emails and keep in contact with everyone that you work with in your rotations, and your professors. Make sure you keep in contact with them so that you can start building that network and those connections.
Absolutely. And another location or another aspect that you can also is through your school, your own alumni, or your alma mater, the school that you graduated from, because they have alumni associations that they always looking for people to help with things, and also a great way to connect with other alumni. So those are all good options just so you can build your relationship. And like Sophia said, you really go in it for the long term. So regardless in what area, you never want to close your door on one aspect of pharmacy, because you never know. Pharmacy is a very small world.
Right.
Any things lessons learned or things you wish you have known earlier as a pharmacy student that you know now, just so help you become a better community pharmacist?
Well, if I had known how to communicate better and interact with people better, then I think it would have helped me in the beginning. But either way, it was a great learning experience. Like being immersed in that setting and then just learning as you go also works as well.
And you're more referring to like communicating, like how to manage the technician's workflow and just being a supervisor in addition to be a pharmacist, right?
Yes.
Okay. Yeah, I think that's always a hard skills to learn until you actually can read a lot of books, but books don't really give you the skill set that you need. So being the training, but at least just familiarize yourself with it. One last thing that I want to leave is that if you have, regardless wherever you decide, especially for community pharmacy, I think it's always good to really keep your network and broaden it even more. So being involved in organizations really truly help, and what Sophie was saying is really reach out to folks just so you are in the process of, and express to them that you're interested. So even for those that don't have a job right now, you show interest and you give them your CV and resume. It helps because they may remember you later on. Well, that's a wrap for our community pharmacy series. I hope that was helpful. If any questions or comment, please post it below. Again, you can connect with me through LinkedIn and post your questions there as well, but I'll recommend you post it in the YouTube video. I hope you hit the like button as well as subscribe to my channel for future videos. That'll be helpful to you. Thank you. Ciao.